Types of COVID-19 testing. First, standard PCR test. PCR tests are accurate at detecting the presence of coronavirus. PCR test is free for everyone in Australia. When should I get standard PCR test? You should take a standard PCR test at a testing site if you have COVID-19 symptoms, even mild, slightly runny nose, headache, or sore throat. Are a contact of someone who has tested COVID positive. Have had a positive rapid antigen test. A standard PCR test is required to confirm your result. Require a negative test result to end your isolation or quarantine. When you get a message from the Department of Health or Public Health Unit telling you to get tested. Rapid antigen test. Rapid antigen test can be used at home to check if you have COVID-19. These tests are faster, but they are not accurate. You should only depend on the standard PCR test if you have any symptoms. If you test positive using rapid antigen test, a standard PCR test is still needed to confirm if you have COVID-19. Rapid antigen tests are not free. You will have to buy them. They are available in some supermarkets, pharmacies, or online. When can I use a rapid antigen test? Remember, if you have any COVID-19 symptoms, you should have a standard PCR test because it's the only test that gives an accurate result. Examples of when to use the rapid antigen test. When recommended by the Victorian Department of Health, such as if you are a workplace or education contact and have already had a negative PCR test. As part of an observation program such as one organized by your school or employer. If you want to quickly check if you may have COVID-19. Before attending a gathering with people in crowded indoor or outdoor places, for example, family gatherings, weddings, funerals, and nightclubs. Before visiting a person vulnerable to infection or going to a high-risk setting, for example, aged care facility. If you get a positive rapid antigen test result, you also need a standard PCR test to confirm. Where should I get the standard PCR test in Geelong? First, Barwon Health operated site. Barwon North Drive-through testing site 155 Princess Highway, Norlane. You must be in a car to visit this service. Please do not ask anyone outside your household to drive you. Only your household family member should take you. Do not catch a taxi or public transport to the testing site as we do not want to spread this virus to other members in the community. Other sites independently operated. Belmont, Cardinia Health. Belmont, Foresight Pathology. Belmont, Australian Clinical Labs. Newcomb, Foresight Pathology. Newtown, Australian Clinical Labs. Ocean Grove, Bellarine Respiratory Clinic. Torquay, Spring Creek Reserve. What if I cannot go to a COVID-19 testing site? For those who are unable to access drive-through testing sites, there is a call to test service, home testing, from Barwon Health is available to people with an injury, chronic health issue, or greatly affecting mobility, people with moderate to severe disability, people with moderate to severe mental health or behavioral issues, carers for a person with moderate to severe disability, people without access to a vehicle for drive-through. What should I do? Call the visit at reception on 03 5260 6000 or call the coronavirus hotline on 1800 675 398. Select 0 for an interpreter service or go straight to option 5. The team will contact you to arrange a time to visit the home. They will ask you several questions using an interpreter to make sure it's safe for the nurse to visit. For example, do you have any animals at your house? These will need to be locked away when the nurse attends. Who will be present at the house when the nurse arrives? Are there any gates to be opened to access the front or side door? Are there any issues with weapons, drugs, or alcohol with anyone in your household or your neighbors the nurses need to be aware of? You will be asked to come out to the front with your mask on and only take it off when the nurse tells you to.